There's been tremendous progress in finding medicines to treat breast cancer. Unfortunately, some of those drugs can increase the risk of heart disease. That has doctors working on ways to prevent cardiotoxicity. Joining us on today's Heart of the Matter to talk about those prevention efforts is Dr. Stacy Smith with the Memphis Heart Clinic. And Dr. Smith, thanks for joining us. All right, here's a question. What does cardiotoxicity mean for breast cancer patients, and how is it detected?
Cardiotoxicity means that treatments that are used to cure breast cancer can have effects on the heart, either the heart muscle, the valves, the artery, or the conduction system. And there are many treatments that can be used to detect and prevent that.
How do treatments for breast cancer damage the heart?
There are several different ways. Some of the medicines directly damage the heart cells, but other medications affect the blood supply to the heart cells. Radiation can cause scarring of the valves or the arteries, and also can cause scarring of the conduction system or the sac around the heart.
What can be done to prevent heart damage while treating breast cancer?
First of all, identifying the patients at the highest risk. Those patients are over 65, those who have high blood pressure, diabetes, those who already have heart disease are the highest risk. And treating their underlying heart problems, making sure their blood pressure is controlled, making sure that their diabetes and cholesterol are controlled would be the first things. After that, what we can do is to screen them with ultrasounds or echoes. And if their heart muscles are at all being affected by the chemotherapy, we can start them on medications that can reduce the damage that occurs and keep their heart muscles functioning properly.
What's the long-term prognosis for breast cancer survivors who have been exposed to cardiotoxic therapies?
It's excellent. It's actually very rare. For the biggest chemotherapy agents, it's about a 2% risk. For some of the newer agents, it's about a 0.4% or 4 in 1,000 people. And with earlier detection, we can give medications that almost all of these people respond to, and in the end will do very well and be able to be cured from their breast cancer and live very healthy lives.
And how can a breast cancer survivor find out if her heart has been affected by her breast cancer treatment?
The best way is a simple ultrasound test, an echocardiogram, and that can look to see if the heart muscle has been weakened. If there are other symptoms, such as chest pain, shortness of breath, then other additional testing may be needed, such as a stress test.
And the good news in all of this is that breast cancer victims, people who are suffering from breast cancer, are surviving this disease to the point where they're having challenges with their heart, but you can address all of those issues.
You're absolutely right. That is the most important point, is that women who get breast cancer are surviving. They're surviving and living normal lives, and now they're living long enough so that they develop heart disease, which is the most common disease affecting women. And the exciting thing about really that is that we can treat heart disease and we can prevent it by keeping blood pressure controlled, exercising, being sure diabetes is controlled, addressing high cholesterol problems, stopping smoking. All of those things can really prevent heart disease.
Well, Dr. Stacy Smith, cardiologist with the Memphis Heart Clinic, thank you so much for being with us today on Heart of the Matter.